It was really bizarre, but I would do it again.
Well, we've all heard of laughing gas for patients at the dentist's office, right? It's sometimes used if you get a tooth pulled or you need a dental procedure. But how about using it during child labor? Well, it's been around for other parts of the world for years, but now it's gaining traction in Western New York. And 7 Eyewitness News reporter Allie Toohey is revealing why more local moms are taking advantage of this trend.
What do you see?
Ayla Kramer is getting used to life as a busy mom of 4.
Gonna fall asleep, aren't you?
The 28-year-old from Dunkirk gave birth to her son Weston at Mercy Hospital on January 2nd.
Weston was my biggest baby, coming in at 7 pounds, 2 ounces, and 20 inches long.
And for the first time, Kramer opted to use nitrous oxide, more commonly referred to as laughing gas, during labor.
I could still feel everything, but it made me able to focus and get through that portion of I can't do this, and just made me focus more on breathing.
Mercy Hospital is one of only 2 hospitals in Western New York to offer NO to patients in labor.
How often would you say you're seeing this request?
I think currently probably 1 to 2 times per week.
Dr. Susan Littler is chair of OBGYN at Mercy Hospital. She says more patients are requesting it as word spreads about its benefits.
It's non-narcotic, and they don't have to have a needle stuck in their back, and they don't have to scream. So it gives them an alternative for pain management.
A patient can use a mask to breathe in the NO during a contraction to help relieve some of the pain. And once she feels relief, she can remove the mask from her face. At 50% nitrous oxide, 50% oxygen, it's less potent during labor than it is in the dentist office.
The goal of this is to alleviate pain without knocking the patient out.
How's our patient in 2920?
Oishei Children's Hospital is also seeing an increase in NO requests among patients.
It was the #1 request on our tours that we gave.
In Ayla Kramer's case, she'd never heard of using laughing gas during labor before her nurse made the recommendation. But she's glad she did. She says her recovery time was shorter compared to when she used an epidural in the past.
Once he was born, it was real easy, nothing. I didn't feel weird afterwards. I didn't feel drugged up. I felt fine. It was really bizarre, but I would do it again.
In Dunkirk, Allie Toohey, 7 Eyewitness News.
That's really fascinating.
Yes.
Allie answered all of my questions. I was wondering if there would be any side effects. There really aren't. And what I realized in watching this is that you're really only using that mask when you have a contraction. So you're breathing in, focus on your breathing, and then kind of releasing that pain.
I think this is something a lot of people are going to be talking about now that they know that it's available here in Western New York. A great option.
Looks like it might be the way of the future, too. Well, anyway, here